अभी बहुत ही पॉपुलर और वायरल स्टोरी चल रहा है अराउंड दी न्यूज़ एंड सोशल मीडिया ऑल्सो. इट्स कॉल्ड व्हाट्सएपिटिस. कभी आपने ये नाम सुना है? अ लॉट ऑफ डॉक्टर्स आर नाउ वार्निंग कि फ़ोन लिंक्ड जो यूज़ होता है हमारा ओवर यूज़ ऑफ फोन्स इट लीड्स टू हैंड पेन्स एंड इंजरीज. हेल्थ केयर प्रोफेशनल्स आर एक्सप्लेनिंग दैट देर आर risks which are appearing to be more than normal now about the increased use, which is more than 5 to 6 hours of use of your social media on your phone per day, which leads to younger individuals having hand issues, पेन्स इन द हैंड, इन द फिंगर, जॉइंट्स एंड बहुत सारी इंजरीज भी हो रहे हैं. डॉक्टर्स इन द यूएई आर रेजिंग कंसर्न्स दैट देयर इज अ राइजिंग ओनरशिप ऑफ frequent use of mobile phones that have been linked to an increase in hand and wrist pain even among children, and overuse is led to a condition called WhatsAppitis. तो ये condition है जो overuse of mobile phones के जरिए young people are facing hand pain issues, injuries, and we've got a doctor online with us. We've got Dr. Jose Manuel, consultant orthopedic surgeon, Medcare Orthopedic and Spine Hospital से. Good morning, Dr. Jose.
Yes, hello, good morning.
So, Dr. Jose, what is exactly this WhatsAppitis?
Hi, good morning. Yes, it's a term that it's evolving quickly, and it became first a word of mouth in some Congress. At least this is how I saw it, and then in some general media. But now it's true that there's been more interest in it, and there's been some publications. And at a personal level, I've been for a couple of for a decade and a half seeing this particular issue. Yes.
Right, Dr. Jose, in the Lancet study in 2014, WhatsAppitis was, considered a broad term. A repetitive strain and injuries were identified with the use of mobiles. How has this become even more aggravated and, leading to conditions of arthritis also?
Yes, that is a good question, because you see, in science, we many times say that an association, or we call it technically a correlation, doesn't always mean that there's a cause-effect relation. This means that we're seeing many hand surgeons that the population has possibly an association in between the two things, the WhatsApp or the use of the thumb in the phone, and the presence, the increase in this kind of problems. But we're not too sure if it's really here an issue that's being something to raise our eyebrows too high. This means, I'm going to put it in simple terms because this is how I see it in my daily practice. This kind of issues that we're talking about, if we have a young person and starts coming with pain in the thumb, my question is always, okay, you have, when I see your thumb, young person, you seem to be having a tendinitis, an inflammation of the tendon. Those are very frequent, and they're not dangerous. They're just very annoying. And they can happen just by doing any sports. You go play racket sports, it happens a lot. Now, when this person comes because of a thumb hurting, I'm always wondering, okay, was it because you did the WhatsApp, or because you're also doing sports, and it's getting worse because of the use of the phone. So if it's getting worse, it's just because you're like a young person, you're using a lot of your thumb, and it's getting worse. But so my what I'm trying to tell you here is that I see that there's the WhatsApp makes things worse, but I'm not too concerned because of the kind of things that come into to my office, which are minor things, minor problems like tendinitis, mainly in young people, that get worse, but they're not the end of the world. With proper treatment, it gets back to normal. It just takes a few weeks.
Doctor, what are the simple prevention methods and some practical steps that you can recommend to our young listeners?
Look, when they start having the pain in the base of the thumb because of using the mobile a lot, I always tell them, look, change now for a few days or weeks the way you use the thumb, and use the index instead. So you're poking those dials with the other finger, and now start stretching. I show them some stretching exercises. By doing that, most of the times it reverses as if they had been having the same issue by playing sports. That's basically the same that we tell them when they have a tendinitis from a racket, or in ladies that have a kid. These tendinitis are very frequent, and these are almost cause effect with the pregnancy that they had, the liquids that they retain, and it increases the chances of having the same tendinitis that we're talking about in the base of the thumb, for example. And in this kind of cases, I tell them, look, use the index, start stretching, let's do some physio, and let's meet every couple of weeks. So basically what I'm telling them, the people with the WhatsAppitis, is the same as what I would tell in a lady with a pregnancy or in a person that's been playing racket sports.
Doctor, with regards to using ergonomic tools and accessories, could you recommend a few that our listeners can actually use if they've got joint pains or hand pains with the overuse of phones?
Yeah, for using yes, when the pain is severe, and I tell you as well because I was also a patient, not only a doctor. I mean, I had this injury, this issue a couple of times. And in my case, it wasn't because of the WhatsApp. It's because we surgeons, we have sometimes particular ways of using the hand that repetitively strains this kind of base of the thumb issues. So it's the same as WhatsApp. But so in my case, for example, I bought for using for a few months a pen mouse, which allows me to grab the mouse in a way that was not bothering me. Or I was adapting my desk and having the keyboard a bit higher than usual, because if you have it too low, your hand tends to and the thumb tends to pull back in a way that hurts much more, and it perpetuates the. So yes, there's a list of things. It's easier to personalize to the person I have in front, because I ask them, okay, what do you do? How do you use your desk? What are your sports about? And then once I understand what their life is about, I tell them, okay, you're going to modify this, you're going to modify this, use this kind of support so that you're containing a bit this story.
Thank you so much, Dr. Jose. It was lovely to have you on our station and on our show. We hope to get connected to you back soon. And until then, thank you for giving a breakdown of what exactly is WhatsAppitis, and our listeners will now be better informed about what to take care of in the future.
Okay, thank you very much. Have a great day.
Likewise.
डॉक्टर जोज मैनुअल से बातें हो रही थी, कंसल्टेंट ऑर्थोपेडिक सर्जरी मेडकेयर ऑर्थोपेडिक इन स्पाइन हॉस्पिटल. व्हाट्सएपेटाइटिस क्या है ये? समझे आप क्या?
बिल्कुल समझ गई कि यू शुड नॉट यूज योर फोन्स वेरी ऑफन. 4 to 5 hours के ऊपर बिल्कुल भी नहीं यूज करना चाहिए. वी शुड ट्राई टू टेक आवर ब्रेक्स एंड ऑल्सो ट्राई टू यूज सम फिजियो एक्सरसाइजेस, आवर हैंड एक्सरसाइजेस, सम फिंगर मूवमेंट्स एज वेल. जैसे डॉक्टर होज ने कहा कि हमें बहुत इंपॉर्टेंट है कि वी हैव टू कीप मूविंग आवरसेल्व्स वेयर पॉसिबल एंड लिमिट आवर सोशल मीडिया यूज, लिमिट आवर फोन यूज.
क्या नहीं करना है ये तो हमें पता है, करना क्या है फिर?
करना ये है कि बैलेंस रखना है सब चीजों की.
सुनते रहिए, आगे बढ़ते, टॉक बिजनेस, उसके बाद रुक जाना हो जाना, हमसे 2 बातें. ऑल दिस आधे घंटे बाद फिर मिलेंगे.
Call us and talk free of charge. 800 81003. Talk 100.3. The latest up-to-the-minute business news, analysis and opinion from the BBC. Talk Business, exclusively on Talk 100.3.
This is Andrew Peach. On the way, NATO leaders are in the Netherlands as a summit centred on increasing defence spending begins.